I was a senior director at Kite, a Gilead company, for a number of years, and worked on the registrational CAR-19 programs there. So both Yescarta and Tecartus. And initially, when I signed up for the CAR-TCR event, I was at Kite, and we were going to further explore a lot of the data that we had generated on our trials in leukemia and lymphoma to discuss the learnings around mechanisms of resistance, or probably more importantly, relapse to CAR T-cell therapy. So, the overall response rates are very high, over 90% for the most part. So resistance is not a term, it's not the best term for CAR T therapy, but patients do relapse, about half of them, 60% over the course of a year into 2 years will relapse through a variety of different means. So the presentation now will have to focus on what's published, but there are some general learnings that we can think about. The first, these are T-cell based products, and so you have to take into account, and these are autologous products, that there are going to be differences across patients related to their disease and also their prior lines of therapy. The more heavily pretreated a patient is, the worse their T cells seem to function, and that seemed to be a general concept that held up across different indications, whether it was ALL, leukemia, or DLBCL, in the NHL setting. So that T cell fitness and function piece can actually lead to a lack of a response, very rarely, where the cells fail to expand. They just don't have the proliferative capability due to the patient's disease, their overall health status. And then there's also a functionality piece. So products that have more functional or polyfunctional T cells. We published some of this work and this concept a few years ago with collaborators, Jim Kokendorfer and Dr. Steve Rosenberg at the NCI, demonstrating that the more polyfunctional a product is, meaning the more the T cells that are present can perform multiple tasks, cytolytic function, produce certain inflammatory cytokines or chemokines, what have you. But the more of those cells that are in a product, the better those patients seem to do. On the other end, you have the patient characteristics. How well do patients respond to lymphodepletion chemotherapy? What are their levels of homeostatic cytokines? How IL-15, for example, that we know plays a role in promoting the expansion of activated CAR T cells, leading all the way to the microenvironment and barriers that T cells have to face and overcome to not only home in and enter into an area of tumor, but then to identify and destroy those tumor cells. And so there's a constant pushback between the tumor and the T cell. The tumor's trying to escape, and the CAR T cells are trying to identify and kill those tumors. And so you have immunosuppressive tumor immune microenvironment. And then you also have target antigen loss, which can occur in a subset of patients. So under heavy selective pressure, CD19 pressure, you end up getting some tumor cells that will escape. They'll downregulate or lose CD19 in this example. And then those cells will emerge. And then you also have situations at relapse where we've looked at and put this information out into the public sphere, that the patient's tumor actually changes dramatically over the course of treatment and that relapse. And so you may have an permissive immune microenvironment at the initiation of therapy, but at relapse, when we go back in and look at the tumors of those patients, they have an immune desert phenotype, so almost no cytolytic T cells. They seem to then begin to enrich for more myeloid-derived suppressor or myeloid-derived suppressor phenotype, or more of a regulatory T cell environment. So those are really, truly difficult then tumors to treat at that point, at least with cell therapy products that we currently have available to us. So it's really combining this product, tumor, patient-related features that we'll want to talk about, and what we've learned from that experience that helps us to design next-generation products that may be able to improve upon the tremendous success that we've already seen with CD19 CAR T-cell therapy. So that's going to be one end of the talk at the CAR-TCR Summit. And then, of course, it'll lead into the company I'm with now, CERo Therapeutics, and what our technology platform is, and how we feel we can apply this platform to overcome some of these challenges that the field faces.